Hello everyone. In this video, we will talk about the mnemonics of drugs of gastrointestinal tracts, the drugs acting on gastrointestinal tract. So, starting from the first mnemonic, which is use of H1 blockers. Although H1 blockers have no use in the GIT, the important blockers are H2 blockers. But we will study first H1 blockers. The H1 blockers are divided into two generations, first generation and second generation. The first generation include diphenhydramine, diamine hydrinate, doxylamine, promethazine, cyclizine, chlorpheniramine, while second generation include cetirizine, fixofenadine, loratadine, and desloratadine, while H2 antagonists include cimetidine, famotidine, ranitidine, and nizatidine. These were H2 antagonists. Okay, so we are talking about uses of H1 blockers. The first generation have four important clinical uses, and the mnemonic is process anticholinergic properties because H1 blockers, specifically first generation, have some sort of anticholinergic properties. So the mnemonic is process anticholinergic properties. P for Parkinsonism, A for acute muscular dystonia, C for common cold, allergy, rhinitis, urticaria, hives, and last P for prophylaxis. That means prevention before treatment. Prophylaxis of motion sickness. This was H1 blockers. While we are talking about the drugs used in acid peptic disease. What is acid peptic disease? These are group of disorders involving ulceration of mucosal lining of GIT. These further include five disease: gastroesophageal reflux disease, gastric ulcer, duodenal ulcer, non-ulcer dyspepsia, stress-related gastritis. Okay, these are the ulcerative erosion of lining of upper portion of GIT. These drugs are antacid, H2 receptor antagonist, proton pump inhibitor, sucralfate, misoprostol, colloidal bismuth, and antibiotics. Starting from the last group, antibiotics. The antibiotics which are important in peptic ulcer are amoxicillin, clarithromycin, okay, or in case of penicillin allergy we use metronidazole. So we use one regimen consists of proton pump inhibitor, that is omeprazole, esomeprazole, lansoprazole, pantoprazole, rabeprazole, plus course of calithromycin and amoxicillin, and in case of penicillin allergy we use metronidazole. Second last is colloidal bismuth. Colloidal bismuth has multiple actions, including first is protective coating on ulcerated tissue. Second is stimulation of mucosal protective mechanism, that is secretion of mucus and bicarbonate ion. Number three is direct antimicrobial effect, specifically on Helicobacter pylori, which causes non-NSAID induced peptic ulcer. And the last but not least is sequestration of enterotoxins. Okay, they also reduce stool frequency and liquidity in infectious diarrhea, while the mnemonic is bismuth cause black stool. Bismuth cause black stool. Okay, let me show you bismuth, B for bismuth and B for black stool. Black stool. Okay, bismuth causes black stool, while antibiotic use is clarithromycin, amoxicillin, and in case of penicillin allergy we use metronidazole. Next come misoprostol. Misoprostol is prostaglandin PGE1 agonist or analog. The misoprostol increases mucosal protection and inhibit acid secretion. So it is used in case of ulcer caused by NSAID, which include aspirin, irreversible, and reversible include indomethacin, naproxen, bupropion. Okay. Next comes sucralfate. The sucralfate, what they does? The sucralfate is actually aluminum sucrose sulfate. sucralfate. This is small, poorly soluble molecule which polymerize in acidic environment. So it requires acidic environment for polymerization. This binds to injured tissue and form protective coating on ulcerated tissue, just like colloidal bismuth. And the sucralfate increases the healing of the ulcer. Okay. Next come proton pump inhibitor, omeprazole is the prototype. These are lipophilic weak bases. First of all, they diffuse into parietal cell canaliculi. They become protonated and concentrated more than 100-fold. Then they convert into that compound which inhibit parietal cell hydrogen potassium ATPase, the pump which is responsible for production of stomach acid. The proton pump inhibitor are more effective than H2 antagonist for gastroesophageal reflux disease, peptic ulcer, gastric ulcer, non-ulcer dyspepsia, and stress-related gastritis or mucosal bleeding. They are also useful in the condition of or in the treatment of gastrinoma and other hypersecretory conditions. What are the adverse effects? The adverse effects include abdominal pain, diarrhea, hypergastrinemia. Okay, the proton pump inhibitor decreases the oral bioavailability of vitamin B12 and digoxin, and ketoconazole. Digoxin is cardiac stimulant used in heart failure, while ketoconazole is antifungal drug which also inhibits the steroid synthesis and causes gynecomastia. Next come H2 receptor antagonists. These include the prototypes cimetidine, ranitidine, famotidine, and the nizatidine. These inhibit the stomach acid production, especially at night. They are effective in the treatment of gastroesophageal reflux disease, peptic ulcer, non-ulcer dyspepsia, mucosal stress-related gastritis, and they inhibit H2 receptor. While the first group is antacid. Antacid are also weak bases, just proton pump inhibitor are. But proton pump inhibitor were lipophilic, but antacid are not lipophilic. They neutralize stomach acid by reacting with protons, and they also stimulate the protective function of gastric mucosa, just like colloidal bismuth do. Okay. The antacids differ in their absorption and effects on stool consistency. The popular antacids include magnesium hydroxide, aluminum hydroxide. Both are weak bases, but neither of these weak bases is absorbed from the bowel. The magnesium hydroxide has strong laxative effect, so you have to write Lm. L for laxative and M for magnesium, while aluminum hydroxide has constipating action. Strong laxative action means to treat constipation, while aluminum increase or precipitate constipation. Okay, the calcium carbonate and sodium carbonate are also weak bases, but they are different from aluminum and magnesium hydroxide on the basis of their absorption from the gut. But they have, because of their systemic effect, they are not used as antacid. This was all about acid peptic disease or drugs. Next come hepatic necrosis causing drugs. Three important drugs causes hepatic necrosis. What are these drugs? Let's see. The mnemonic is very angry hepatocyte. Very angry. V for valproic acid, A for acetaminophen, and the H for halothane. What is valproic acid? Valproic acid is anti-seizure drug. Anti-seizure drug. There are mainly four type of important seizure: tonic-clonic, partial seizure, absence seizure, myoclonic seizure. For tonic-clonic and partial seizure, the mnemonic is, let me show you. The mnemonic is polyvinyl chloride. You have to memorize polyvinyl chloride, PVCl. P for phenytoin, V for valproic acid, C for carbamazepine, and L for lamotrigine. The carbamazepine inhibit or block sodium channels, while lamotrigine block both sodium and calcium channel, while phenytoin is specific for sodium channel and valproic acid has multiple actions. Next come absence seizure. For absence seizure, you have to write the mnemonic is CEV, CEV, C for clonazepam, and E for ethosuxamide, V for valproic acid. The valproic acid is used in all the seizures, whether myoclonic, whether absence, whether tonic-clonic, whether partial seizure. While for absence seizure and the myoclonic seizure, the drug which is common is first of all valproic acid and another is AM. A for absence seizure, M for myoclonic seizure, and the drug is the clonazepam. Note that clonazepam has last two letters AM, so it is used for A and M. A for absence seizure and M for myoclonic seizure. Okay, the difference is between the absence seizure and myoclonic seizure is one drug. That is, absence seizure include ethosuxamide, while myoclonic seizure include lamotrigine because myoclonic include L letter for lamotrigine and abscess include ethosuxamide. Okay, what are other backup drugs for anti-seizure? Felbamate block NMDA type glutamate receptor. Gabapentin block calcium channel. Locosamide and many other drugs block sodium calcium channel. Zonisamide block sodium channel. Vigabatrin inhibit gamma aminotransferase. Tiagabin inhibit GAT1 GABA transporter. Rufinamide block sodium channel, while phenobarbital is barbiturate, which block GABAergic receptor. Sorry, which stimulate GABAergic receptor. Okay, so so that valproic acid is anti-seizure drug which has multiple action. Next is acetaminophen. What is acetaminophen? Acetaminophen is studied in NSAID chapter. Acetaminophen is the over-the-counter non-inflammatory. It doesn't causes non-anti-inflammatory. So it is not used for inflammatory condition. It is analgesic, over-the-counter analgesic used in USA. The mechanism of action is this drug block cyclooxygenase type 1 and type 2 in peripheral tissue but has very weak action so that it has no anti-inflammatory effect. Acetaminophen also inhibit third enzyme which is cyclooxygenase type 3. Cyclooxygenase type 3 is present in CNS while 1 and 2 is present in peripheral tissue. Acetaminophen is analgesic and antipyretic, but it has no anti-inflammatory or antiplatelet action. Okay, the acetaminophen is useful as aspirin substitute, especially in children with viral infection and in children with aspirin intolerance. Okay, there is important relationship between alcohol and the acetaminophen. Alcohol increases the toxicity of this drug. Okay, and the antidote for this is acetylcysteine, which is sulfhydryl donor. Okay, sulfhydryl donor, so that the person who regularly consume three or more alcohol drink are increased risk of acetaminophen induced hepatotoxicity. Last drug is halothane. Halothane is studied in the chapter called general anesthetic. General anesthetic are divided into two groups: inhaled, intravenous. Inhaled are further divided into gas and halothane. Okay, halothane. The factors which affect the speed of induction of anesthetic effect include solubility, inspired gas, partial pressure, ventilation rate, pulmonary blood flow, arteriovenous concentration gradient. These factors determine the speed of induction of anesthetic drugs. The inhaled anesthetics include halothane, desflurane, enflurane, isoflurane, sevoflurane, methoxyflurane. Okay, these are all inhaled anesthetics, while intravenous include barbiturate, dissociative, which include ketamine, miscellaneous, etomidate, propofol, opiates, fentanyl, and benzodiazepine include midazolam. Next come the HMG-CoA reductase inhibitor. The HMG-CoA reductase inhibitor are used for lowering of plasma cholesterol, hypercholesterolemia. Okay, these are agents used in dyslipidemia. So what are the side effects? Side effects. First of all, mnemonic is HMG-CoA. So H for hepatotoxicity, M for myolysis, rhabdomyolysis, rupture of or necrosis of skeletal muscle, contraindication during pregnancy and growing children, while interaction include coumarin and cyclosporine for C. Okay, coumarin and cyclosporine. This was all about important drugs acting on GIT, but we have studied many parameters of pharmacology. Hope you have liked this video. Please subscribe our channel for more and more notification. Stay tuned. I think I have tell in a wrong way. Anyhow.